6 News. Today is Wednesday, October 16th. I am Michael Coward, and with me is my co-host, Breeze Rattler.
Thank you, Michael. Tonight at 5 o'clock, Neuroscience, A Brave New World, we will ponder the present and visit the future. We'll be right back after the break.
Have you ever needed to perform surgery but have shaky hands?
Have you never been able to get that precision or accuracy?
Are you too scared to perform complex operations?
If you answered yes to any of these questions, then you need a Da Vinci bot today.
Call 1-800-SURGERY and receive your very own Da Vinci bot within 3 days, only 90 easy payments of $50.99.
Da Vinci bot, Da Vinci bot, Da Vinci bot is the bot for you. Da Vinci bot, Da Vinci bot, your patient will look good as new.
Welcome back live with our special guest, neuroscientist Dr. Wilson and Dr. Esposito.
Thank you, Breeze. Dr. Wilson and Dr. Esposito, I have a few questions about the present condition of neuroscience and where it's heading. Where do you feel neurology is heading?
I believe neurology is going to become bigger and better. I believe we are going to be able to control things such as disorders and disabilities with our new scientific studies.
When you look at how neurology has advanced, it really has only gotten better. And as neuroscience heads forward, there's going to be more and more controversy about essentially playing God.
That's interesting. So if you think neurology is going to cross lines, how do you think this will affect advancement?
Well, it depends on how you look at the whole picture. This may be good for neuroscience so that more people can get involved in the advances and have these abilities.
Also, advances may be set back because of different obstacles we may run into morally in the future.
So does morals and ethics affect the advancement?
Oh, yes, definitely. See, just like cloning is banned right now because of how negative the publicity has been, so neuroscience may be banned if they get too much bad publicity.
And when you have bad publicity, yeah, to certain people, you may not be able to get government support.
Okay, so are neurosurgery safe?
It really depends on who the person who is performing the surgery and what the surgery is.
Okay, thank you. So we have Dr. George Martin speaking about back surgery.
Ooh.
Well, as far as the success rate for these type of surgeries, again, every situation, every patient is different. And unfortunately, there are risks with surgery. Otherwise, we do surgery on everyone. The microdiscectomy surgery, minimally invasive microdiscectomy surgery, is around 95% successful in relieving people's pains and getting them back to doing what they were doing before. There's about 3% of people who don't get better, and that's because the disc itself has compressed the nerve so severely that the nerve is damaged beyond repair. That even doing surgery and taking the pressure off of the nerve won't repair the nerve. The nerve has been damaged so much that the body can't possibly repair it. And we just don't know that ahead of time. There's probably about 2% of the patients from this type of surgery who actually get worse
Michael.
because of all the type of complications that happen with surgery, problems with anesthesia, heart, lung, kidney problems. Specific risks to spinal surgery are basically that the nerves themselves can be damaged during the surgery, the numbness can be worse, the weakness can be worse, the pain can be worse. That's predominantly the success rate of the microdiscectomy surgery. The minimally invasive surgery, spinal fusion, since it's more involved, it's not quite as successful.
Okay, now since we've seen the positive, let's take a look at the negative.
This was our daughter Marissa before she was diagnosed with a brain tumor at age 17 and a half. Her quality of life score was 70 right after surgery. She was speaking and moving normally, and it appeared she would have an average recovery. 2 days after surgery, that all changed. When she left the hospital, her quality of life score was 40, and she was considered temporarily disabled. Marissa has ataxia that she acquired after the surgical removal of a tumor in her cerebellum. Once we were told she had severe ataxia, I began researching for a cure. One local neurologist we saw recommended I look online for studies in China. Specialists in China had successfully inserted stem cells into the empty space where a tumor was in the cerebellum of rats. The cerebellum completely regrew and normal functioning returned. Human trials have been going on with stem cell therapy in China for a few years now, with much success. Our hope is to encourage doctors in the U.S. to focus on stem cell therapy. Not only will this help with ataxia patients, but many other neuro and spinal illnesses and injuries. Whether
How do you feel about Marissa's line?
Marissa is one of the few people who don't have a happy ending. We can't tell if her brain tumor was too far along or if it was the neurosurgeon's fault.
Thank you, Doctor. Back to you, Michael.
Wow, that was incredible. Thank you, Lauren. So from these questions, we can predict where neuroscience is headed.
These intelligent doctors believe accuracy is improving and the technology is advancing.
Different brain and spinal advances are going to be able to cure diseases.
Different neuroscientists have different moral views of how far neuroscience should go.
We have one more story tonight.
We have an inspirational story of a woman named Evelyn.
Evelyn had a large brain tumor in a large portion of the left side of her head, pressing on her brain and the nerve to her left eye.
She had a 15-hour surgery to remove her brain tumor.
Dr. Neil Martin successfully completed her surgery.
Evelyn is fully recovered now and well.
Okay, well, her brain tumor was like about right here.
Oh.